The project I started to work on, I submitted as a poster last year to the 1,000 Lives Improving Quality Together Masterclass, and it was basically called Take Two. Take 2 minutes to look after your own physical and mental well-being. This is for nurses, physios, doctors, anybody working on the ward environment or within clinics to basically think about themselves and their own needs. So visit the toilet, have a drink of water, refocus on the task in hand. This has progressed since last year and is now being taken forward for development within Betsi Cadwaladr University Health Board from a simple student poster submitted to 1,000 Lives last year. Through the Model for Change and through the PDSA cycle of Plan, Do, Study, Act, we noted that staff nurses take their breaks, they focus on their patients, yet quite often breaks get missed or the demands of the ward mean that they can't always take it, and it could be 6-7 hours before they visit the toilet or have a drink of water. With hydration levels being closely linked to concentration levels, it's really important that we remain hydrated, otherwise mistakes are going to be made, people are going to suffer, sickness levels are going to increase on the ward because people are suffering the effects of not looking after themselves properly. It was trialled very briefly on an older person's assessment ward for mental health, and I worked alongside the matron, and we trialled it one very, very busy afternoon where the matron was actually working on the ward due to staffing levels. We trialled it by a covert study of promoting people to have drinks of water, visit the toilet, and the results that she reported back were outstanding. She said she noticed that staff levels of concentration seemed improved, she noticed that staff seemed to have more energy, and she noticed that the level of patient-centred care remained high throughout the whole shift without there being any dips towards the end of the shift because people were putting their own needs first. Improvement methodology is something which is a structure for which you can make positive changes in your ward environment. Positive changes shouldn't be just led from the top, they should be led from the student level, because we're there with fresh eyes. We look around the ward with a different ethos really, because we're there to learn, we're very eager. But what we don't do is realise that we can have an impact. So take your quality improvement idea, work alongside your student educators in university and alongside your mentors, and push for your quality improvement idea to be trialled, because if you don't trial it, how can you know if it's worked or not? Improving Quality Together is actually our final project in our university. The university has taken it on board. So for our final project, instead of a dissertation, we do a quality improvement project. We work alongside mentors and members of the quality improvement team from the trust. So the whole cohort has completed their bronze level, and then towards the end of the third year, the cohort are going to trial their ideas if that's something that they want to do to work towards their silver level. Due to my project being trialled at an earlier level, I'm starting my silver award in January, so I'm hoping to complete my silver by the end of my third year.